all of our panelists could come on up and join me on stage. Thank you. As they're coming up to join us, I'm going to go ahead and introduce our moderator for today, Ashleigh Strange. Thank you, Ashleigh. Ashleigh is a longtime advocate and passionate champion for LGBTQ+ rights. They currently serve as the executive director of the Governor's Advisory Commission on LGBTQ+ affairs. Ashleigh's work has spanned across powerful grassroots organizations, including their previous roles as communications director for both Pennsylvania Stands Up and Make the Road Pennsylvania. A proud graduate of the University of Alaska Fairbanks, Ashleigh holds a degree in broadcast journalism. Beyond their professional work, they continue to lead and serve their community as board chair of the PA Stands Up Institute and vice chair of Planned Parenthood Pennsylvania Advocates Board. I am so happy to have Ashleigh with us today, and I am hoping that you will join me in a warm welcome for Ashleigh Strange.
Make yourselves comfortable. A little elbow room, like if you
Was that a mic drop?
It was. Sorry, Aimee. All right. Welcome. My name is Ashleigh Strange. I use they and them pronouns, and as she said, I'm the executive director for the Governor's Advisory Commission on LGBTQ affairs. Between us chickens, I'm the queer in the governor's ear. So basically, I have roughly 30 commissioners, and our job is to hear from our communities and serve as a liaison between the LGBTQ+ communities and the governor's office. And I'm so glad to be here with this esteemed panel. And I have a short clicker here that if I hit that button, that's me. And then if I hit this button again, Corinne, tell us name, pronouns, where you live, what you have for breakfast.
Hi, my name is Corinne Goodwin. I'm the founder and executive director of Eastern Pennsylvania Trans Equity Project. My pronouns are she and they.
Meredith.
Hi, my name is Meredith.
Yeah, wait, oh.
Hi, my name is Meredith. I use she, her pronouns. I'm a grant and funding specialist at Bradbury-Sullivan and a MPH from Yale University.
Hello, I'm Matthew Easterwood. I use he, they pronouns. I'm founder and CEO of Queer for Hire, a boutique consulting firm that provides fundraising support to queer nonprofits, and I'm so glad to be here today.
Hi, my name is Aimee Van Cleave. I use she, her pronouns. I am the program director for Project 26 Pennsylvania. I'll explain more later. And we work with young voters to help them align their actions and their values.
Thank you all for being here today. We talked a lot about data. This whole convening is for, by, and about data nerds. So we're going to talk a little bit about that, and we'll start with you, Corinne. Why is this data essential for your work, and how do you use the PA LGBTQ Health Needs Assessment to advocate for the community?
Yeah, so probably a couple ways, but the first one is that we use it to get money. So when we get access to the data, we don't necessarily look at it in the full aggregate way. While we will do that when I'm out speaking or doing trainings or things like that, we'll talk about the aggregated state data. But a lot of the funding that we go after is county-based, right? So the Lancaster County Community Foundation gives us money, or the Gender Justice Fund down around Philly gives us money. And so we'll pull that county-level data out of the report, and it allows us to really more effectively speak to the needs of the local community there and build a case for us to get that funding. But then the second place is when we're trying to tell the story of trans, non-binary people, and frankly their family members, and allows us to talk about, in that aggregated sense, what are the challenges that we're running into, and what are the things that we need to be doing to try to rectify those challenges.
And Meredith, for higher education, is it kind of the same thing, or how is it different?
I think it's a combination of very similar but also different, coming at it from a research perspective. I think data gives us perspective into what to look farther into, particularly in implementation science and looking at programs that are backed by research. Broad data like this allows us to get like, hey, community need, and people, for example, people feel like they can make a big impact on their community. What's an implementation project? We can work on that, and there's science behind that. So I think data at the statewide level on queer people is so important for kind of navigating us to the most impactful and long-lasting projects that we can do.
Awesome. Matt, show of hands, who is queer for hire in this room? Yes, okay. All right, connect with Matt afterwards. We're gonna get you hired, don't worry.
Queer for hire and gay for free.
$20 is $20.
As founder and CEO of Queer for Hire, we strive to uplift the LGBTQIA plus community to a level of queer extravagance that accomplishes both individual success and shared equity for all through the power of authenticity, uniting diverse people, and maximizing the abundance of philanthropy on all levels. We provide fundraising to nonprofits that are queer and to nonprofits that are prioritizing the community, and we do cultural competency for straight-led organizations as well as coaching for queer professionals. My work looks like establishing a culture of philanthropy in queer nonprofits so that they are able to maximize the abundance of philanthropy on all levels, because LGBT organizations are vastly underfunded and therefore lack the infrastructure and resources for full-time professional development folks. My work looks like providing LGBTQIABCs trainings to an adult disability service organization because their trans and queer employees are being harassed, and so I teach them about the laws around discrimination in Pennsylvania because their human resources and leadership teams lack the cultural competency to understand the nuances of queer and trans identity. Talking about data, earlier this morning, Adrian said we can't achieve health equity without data equity. Data is the backbone of storytelling and strategy in the work that I do with my clients, especially queer nonprofits. It's how we show up in the language that funders, policymakers, and systems recognize. The PA LGBTQ Health Needs Assessment is a critical tool because it helps quantify what many of us already know anecdotally. Whether it's disparities in mental health access, the need for cultural competent providers, or the prevalence of discrimination in care. I use the assessment across every part of my consulting work: grant writing for clients in Pennsylvania, board development, staff training, and especially multi-year strategic planning in Pennsylvania. It allows LGBTQI plus organizations to validate lived experience with hard numbers, which is essential when advocating for that unrestricted multi-year funding. And because the assessment is updated regularly, we can track trends over time, showing both persistent inequities and areas of progress. Another powerful tool when demonstrating the need for sustained investment rather than one-off project grants. This is crucial because nonprofits in general, especially queer nonprofits, need to diversify their funding and secure long-term investments. Too many LGBTQI plus organizations are stuck chasing short-term grants or one-off project dollars when what they really need is sustained, unrestricted support to do the deep systemic work their communities require. Data like this helps make the case for that kind of funding. It shows that our needs aren't temporary or trendy. They're structural, ongoing, and deeply rooted in systems that have excluded us for generations. Funders in the crowd, this is a message for you. Invest in long-term, unrestricted funding for more marginalized nonprofits and groups. Most importantly, to wrap up, the assessment gives LGBTQIA+ organizations a seat and a voice at the table, especially when sitting across from government agencies or private funders who expect evidence that our issues are real. The data doesn't just support our case, it centers our truth. It's a way to say you don't just have to take our word for it. Here's the research, here's the impact, and here's why your funding must follow. In a world that too often erases or questions our existence, tools like the LGBTQ+ Health Needs Assessment become forms of resistance and resilience. The data tells the truth we've been living, and now we get to use it to shape a future that reflects and serves us all.
Thanks, Matt. Aimee, how does this help advocate for your community?
That's such a great question. So I've worked over the last several years in many different parts of what we're going to call politics, right? I've been a lobbyist, I've been an advocacy director, and I have managed campaigns. And in all of those pieces, what I experienced both as a queer person and in those roles is a constant explaining of myself and what it means to be queer in Pennsylvania, and also what it means for my community at large. And so if we break those down into the constituent pieces of what we think of as politics, you have the people who make laws, right? Those folks in the Pennsylvania legislature, they're gonna vote on over 5,000 different topics in a 2-year period. Now, if you are an expert on 5,000 different subjects, please raise your hand. Great news, neither are they. And so, legislators need to hear from their constituents on every topic that they are debating, because they simply are not an expert either on the execution of the law or the impact that it then feels in their community. So they have to hear from subject matter experts, doctors, medical providers, etc. They have to hear from people who work in housing. They have to hear from people who work in education. Similarly, and almost as important, maybe more important, is they have to hear from people who go to the doctor. They have to hear from people who are looking for housing, and they have to hear from people who are in the education system, because they need to know not just the technical terms, but the actual on-the-ground experience. That's also true for the people who work in government, maybe the Department of Health, the Department of Education, etc., who are now implementing the laws that they did not get to help decide what they are. They just have to navigate, here is what the law is, how can I use it to help this person in front of me? How can I use it to try to fill the needs of my desired community? And then when voters, all of us in this room, when voters are either talking to their legislators or trying to decide what it is that is going to make the difference between who they vote for, they need to be able to clearly communicate, here's how I have felt this experience, and here's how I am not alone in that, but fit into a larger story. So data is essential for, as all of my very intelligent fellow panelists have said, communicating stories in a way that, again, contextualizes it. So we can explain, here's what is happening, here's how that fits into a larger narrative, and here's how my personal experience has been shaped by the decisions that someone else made along the way.
And it's also very helpful at the end, because all of you have a copy of the assessment. At the back, there's all of these summaries, and so those are very helpful if you need a one-pager to sort of like run that by, whoever needs to see it. They're very, very helpful at the end. Corinne?
Yeah, I just wanted to kind of tag on to that piece. So the quantitative data is very helpful across many things. But one of the things that I know when I'm in Harrisburg or when I'm meeting with a legislator or the mayor who's back there eating their lunch, You know, one of the things that's really effective is telling stories, right? And so beyond, you know, the quantitative data is what sort of backs up the case, but the storytelling is what makes the case. And so, unfortunately, especially in today's climate, there's a lot of folks who don't necessarily feel comfortable coming forward and telling their stories, but the qualitative information that is in the report, right, allows us to kind of say, oh yeah, you know, here is somebody from your district or somebody from your town who is having these issues. And so I would say, number one, I would love to have more of that qualitative stuff as well. But on top of that is that we need to make sure that we are, you know, helping people to feel brave enough to come out and tell that story. And if they can't, this is a way that we can do it on their behalf.
I'm gonna just tack one thing and I promise I'm done. That's so correct in a number of ways. I've lobbied for many different healthcare and queer organizations across the country. And what is universally true is a person who makes the law, regardless of their position, actually is uninterested in hearing from me. They know that it is my job. They know that I get to come in there with all of my facts and all of my data, and that I have no decision-making power over whether or not they continue to have a job. They want to hear from the people who do decide whether or not they continue to have a job, what they should do with the job that they have. So my approach, many of my colleagues' approaches, will always be to come into a meeting and be prepared to say, here's my little infographic, here are all these things, I can answer the hard technical questions, but the majority of that meeting is actually going to be Hannah, right, speaking with the YWCA. It's going to be, here's a subject matter expert from your community who is telling you this story. Here is the person who votes for you, who is explaining to you the consequences of that. And it's so easy to break it down. If I could give you one piece of advice, it would be, when I am speaking to anyone in a decision-making setting, I know that it's my responsibility to be the narrator of my own facts. And what I mean by that is, I'm gonna explain to them the what, the thing that they need to know. I'm gonna help them to get to a place where they get to the so what. What does that actually mean? How do we put it in context? And then the final piece is the what next. Now that I know what it is, I know why it matters, what is it that I am supposed to do about it? And if you can at all times structure your conversations in that way, for your grant reports, for your advocacy meetings, when talking to elected officials, you will be really effective in communicating to them what it is, why they should care about it, and then what it is they're supposed to do about it.
These are not hypothetical situations. These are actually happening to actual Pennsylvanians who filled out this form. Well, you get one more. I do have other questions.
I also just want to add the diverse ways that I think we all use it. I use the PA LGBT Health Needs Assessment all the time in my grant writing, but also I walked into a lab at Yale and we had a clinical trial on mental health treatment for LGBT it was at that time New York and New Jersey, and we had a really hard time recruiting people. And I had the needs assessment on my desk because I was grant writing an hour before that meeting, and I said, you know what, people in Pennsylvania need mental health treatment, and they would be a great fit, and here's all these centers that we're already working with. So I was able to use the health needs assessment data to tell my PI that he needs to expand the trial, and it successfully expanded into Pennsylvania, and our numbers skyrocketed, and thankfully, because we were able to add Pennsylvania, we have a large enough data set prior to the conclusion of our study by the federal government to be able to use that data. And without the addition of Pennsylvania, that wouldn't have been possible. So looking for ways to use the health needs assessment in ways that you might not think, and saying, hey, maybe we need to look here. Hey, have you seen this? And just kind of keeping it in the back of your head as you go about your day-to-day life to see where you can implement it and kind of like pin it in there.
And also, there's a list of organizations. You know, Christina's been talking about scanning the QR code that I'm not going to try to pull up on this tiny button, but scanning the QR code to get involved in the next collection phase, because all of the list of people, the list of organizations that participate in that also end up in the book. So as you're reading and you say like, oh, I wonder if there is a BIPOC org in Philly that is working on this. I guess there is. There's 4 of them listed. So, you know, making sure that you keep up with all of them is also important. And I'm So government agencies have either removed, modified, or flagged hundreds of words and phrases. Federal government, not state government, not run Hampton. But some of the most notable terms include diversity, equity, and inclusion. These have been erased from multiple agency documents, including those related to hiring and education programs, climate change and climate crisis. Some environmental agencies have been told to use more neutral terms like environmental challenges, and LGBTQ plus terms. Websites mentioning LGBTQ plus history and rights have been edited, especially within the National Park Service and the Department of Health and Human Services, and many others relating to systemic racism and social justice. So, are these words affecting your grant writing? We'll start with Matt. Matthew, what do you prefer?
Either.
Okay.
Yes, and it's dangerous.
Mm-hmm.
I recently worked with an organization that is contemplating taking out the LGBT acronym from their name so that they can have a better chance in the automated systems that are flagging things like the LGBT acronym. The censorship of words like transgender, diversity, evidence-based, and equity creates a chilling effect that goes far beyond semantics. It puts our lives, our health, and our funding at risk. In the grant writing world, it means we're often walking a tightrope, trying to tell the truth about our communities while avoiding language that might trigger a rejection from a government agency or politically cautious foundation. One strategy is to mirror the language of the funder in your narrative, but still include the words that matter to your organization's mission and vision, statements or staff bios. That way, you're signaling alignment where needed without erasing your truth. Another is to build relationships with program officers so you can ask directly, is it okay if we use terms like queer, anti-racism, or gender expansive? It's better to ask than to self-censor. But here's the truth we really need to talk about. Nonprofits need to stop believing that grants are going to save them.
I need more claps on that one, please. Thank you.
The current landscape proves that relying solely on government funding or institutional philanthropy is a risk we cannot afford. Political tides shift, priorities change, and in moments like this, when words themselves are under attack, we see just how fragile that house of cards really is. That's why I'm constantly encouraging queer nonprofits to diversify their revenue and invest in relationship-based fundraising with individuals who already care about your mission, peer-to-peer campaigns that activate your base and build power as you raise money, board development that doesn't just fill seats, but builds champions who give, get, and advocate. Private, unrestricted funding from values-aligned donors and foundations who are less vulnerable to political whims. Grants have their space, yes, especially when grounded in community-based data like the PA LGBTQ plus health needs assessment. But they cannot be the foundation of a sustainable funding strategy, especially not when you're asked to strip your identity from the application just to get through the door. My advice, write boldly, speak truth in your proposals, and stop begging systems that weren't built for us to see our humanity. Build your own funding ecosystem, one that is rooted in community, not compliance.
I'm gonna let you go in a second, but sometimes, especially for folks who do a lot of fundraising, that's very hard to hear. It's hard to take in. So I encourage you to breathe if you gotta, we got a couple of I got a couple of my old therapists in the room. Hopefully they don't talk to each other, but like I encourage you to breathe and think about, you know, what we're hearing, because what we're talking about is not easy. You know, we're talking about the continuation of our work and the feasibility of it. And so I thank you so much for that answer, because it's hard shit.
It's not easy, you're right, Ashleigh. And it doesn't happen overnight. It's not something that happens quickly. So rely on your community, rely on your people, build that ecosystem, make a strategy, and breathe one day at a time.
All right.
I think as we're working on the structural factors, because we're in a time where we're rapidly trying to catch up the structural capacity to fund nonprofits focused on our community, we haven't had that as long of a history to be able to have all these foundations to support. I think my primary goal is focusing on the work that we do and the actual change that's happening. So yes, we are funding the LGBT community, but what are we doing for them? Are we providing health and wellness services? Are we providing toothbrushes? How does that impact people? So not censoring what I'm writing, but shifting the emphasis and focus on, we've provided 400 toothbrushes to these people, which have helped dental quality. And then using our community as we're experts in this community. Everyone deserves dental care, everyone deserves a good quality of life, as health equity is central to the work that we do. And instead of framing it as, and not that this framing is bad, but saying, oh, we're supporting the LGBT community, targeting organizations like when we say, we are experts in our community and we are helping our community in the most effective manner by doing this. And we're able to connect with these people in a unique way. Is that my favorite writing to do all the time? No, I love long essays where I get to talk about all the work we do and how the brightness of our community, and my favorite grants are ones where I get to center queer joy. And I do that all the time, but also really focusing on, this is the health benefit. We are reducing isolation, as like even pulling in, Surgeon General said this, and we are specially equipped to work with our community and address this. And I think that is what keeps a lot of the large corporate and foundation funders engaged at this time.
That's helpful, thanks.
Yeah, so I'm going to go back to the actual question here. So, are the banned words of the current presidential administration affecting your grant writing? And I'm going to say not really. And the reason...
Oh, we got a badass, okay.
Well, a little bit. But, you know, when we built the Trans Equity Project, we specifically built it to be nimble. And we've really worked hard to, number one, not depend on government money. We are very much a crowd-funded organization, and to what Matt was saying, like, you have to build those, you know, interpersonal connections. And so, you know, I'll just give an example. So when we, you know, right after the election happened, our individual donors, I mean, it went up like a hockey stick, right? And it was because we were able to tell our story on that kind of one-on-one basis about what are the things that we're doing on behalf of our community members, right? And tell the story that we really felt that we were going to run into these issues with funders. Where we are seeing the biggest issues, frankly, are with the corporate donors, right? And our corporate donors, in many cases, have reduced their funding to us. We had one donor that said, yeah, we're going to give you money, but you're not allowed to talk about it, right? Because they probably have a very large government grant for chocolate bars with the Army, right? And they're afraid to unnamed chocolate maker. Right, but they're, you know, but they're running scared of the federal government right now, and so what it really is about is like building the case. To your point, like we were able to distribute this many toothbrushes, or we were able to pay this many people's rent, and you can't, you know, survive in this country if you don't have food in your belly and a roof over your head and electricity to charge your phone. And that's what we do. We make sure that people don't hit the street and become the drag on government. And I think that as long as we're able to tell those stories, ultimately we're going to find the people that are willing to fund us and to fund our work. But it gets back to that idea that you got to tell the story and you have to figure out the words that inflect with your constituency.
I will be so brief because I know you have many questions. My organization does not receive federal funding, so I am not currently writing federal grants. To echo what many of my co-panelists said, rather than work within the framework of here is what money is available to do this specific thing that I, as the human with money, want you to do, instead, we write all of our project proposals with here is what is needed and here is what our staff is equipped and able to do, and then I simply find the people who are interested in paying for that. So I do not receive federal grants.
So, and it's a little bit of, you were saying sort of like stretch before that reach, right? You're saying like you can go for this, but don't change who you are, just stretch out a little bit of like the work that you're doing that matters rather than the other way around. And so, do you have more to say about that?
Yeah, so I always, looking at the PA Health Needs Assessment, ground it in the data that we have and the straight numbers. It's always good to I'm so data forward. I think every organization should be collecting service numbers on everything that you do, just because it goes miles ahead by saying we did this many for this group of people. Funders love that, and it sounds very simple, but you'll look quickly back and say, oh darn, we should have asked people this question. It would have given us so much information. This funder would have loved it. So really having a good idea of what people are looking for, because funders have a priority. They make it very clear on their website, and kind of, once again, keeping that in the back of your mind and letting that mold through your mind through the work that you do every day, and say, oh, we have a care cupboard, and we know that this funder really supports like community well-being. Oh, let's start just saying, how many people do we see notice it? How many of this are we going through a month? And then we build up that collection and are able to have a really fleshed out, firm proposal that's rooted in data, and to actually show them the numbers of we are effectively reaching this community that other people aren't able to as effectively reach.
100%, thank you. Wonderful. Adrian talked a little bit about the SOGI data that has been tirelessly working at the federal government level, and a lot of my work with state agencies at the state government level. I talked to a couple of people in here that said that like their hospitals are starting to do SOGI data, and they're really only noticing because they're patients and they go in and find that they're asking this information. But especially as the data is being pulled away from these government websites, how does that impact your work? And you said that you don't receive federal grants, but like, does that affect sort of like how you talk to people or how you interact with folks?
Absolutely, yes. It does impact how I interact with people, how I talk to people. Regardless of whether or not I have a staff of 5 or like last year 500, at all times I encourage folks to use plain language in communication. And what I mean by that is, if you are a service provider, a practitioner, or someone who works in government and gets to make laws, all of those different groups of people sort of develop their own language for how they talk to each other about these topics. And unfortunately, the way that language works is the more hyper-specific you get in definitions, then the less likely someone else actually understands the language that you are speaking, right? Someone who is multilingual, I move through the world differently in one language than I do in a different language. And that is true of people who are deciders, whether that is deciding on what care they provide or what they do with information. And so I advise my staff, and I will advise all of you, to rely on what is true. I could say, well, the ACA does this. And for the majority of human beings outside of this room, they probably are unlikely to know what I mean when I say the ACA. So instead,
Just to say for
the
other folks who
Affordable
might
Care
not know,
Act.
what's the ACA?
It's the Affordable Care Act. Many of you might know it as Obamacare. Instead, the way that I would describe it and explain it to people is, current legislation allows people to stay on their parents' health insurance until they are 26. Or, depending on the context of the conversation, current legislation allows people to receive health insurance regardless of whether or not they were sick before they got that health insurance. And so that is an example that I'm trying to model of how we communicate with extremely clear language. And so, as we remove data from government websites, we have to be better and more nimble, that's a great word, about how we then communicate what is true in an environment in which truth itself has dropped in currency. The value of truth, right, is a declining currency, much like the dollar. And so...
Much like the dollar.
And so, how do we move around the world differently? It is, again, by just stating in the clearest language possible, and that I think would also apply to the question around grant writing. I loved that your answer about we just give toothbrushes to people, right? If we're talking about housing, if we're talking about healthcare, if we're talking about employment opportunities, just being able to say what is true. Right now, our organization works to talk to young people about what matters to them. We know that young people are concerned about whether or not they can afford to be alive. I don't need a data point to be able to show that graph, and I have to also collect my own. We had 2,800 conversations with students around Pennsylvania this last year as my organization. I now have both numbers I can point back to that supplement the health needs assessment. I can get really into specific numbers. How many young people are queer, how many of those young people are unhoused, so on and so forth. And I have the qualitative data that shows here's an actual, don't listen to me and my words, here's an actual sentence from a young person in Allentown, a young person in Scranton, about their concerns around will I be able to pay my rent or pay for my health care when I turn 26 next month.
That's very good. Thanks, Matt.
When data disappears, so do our stories, our needs, and our legitimacy in the eyes of policymakers and funders. Removing data is not just bureaucratic negligence, it's an erasure tactic. It's a political decision to pretend our community does not exist, doesn't suffer, and therefore doesn't deserve investment or protection. If we're not in the data, we're not in the budget, and we're certainly not in policy priorities. This kind of erasure has real-world consequences. It impacts everything from how funding is allocated to which services are deemed essential to what legislators cite as when debating healthcare access or non-discrimination laws. It becomes much harder to advocate for our communities when we're made invisible by design. For me and my clients, the disappearance of government data means we have to work twice as hard and twice as creatively. We turn to community-led research, like the PA LGBTQ Health Needs Assessment, which is a gold standard for data justice, created by our community for our community. And it's grounded in lived experience. We also lean on academic partnerships, cross-sector coalitions, and regional data collaborations that are willing to center LGBTQI plus populations even when governments don't. At the same time, this moment demands that we become more proactive and protective with data. We can't just trust that information will always be there. We have to archive and safeguard it ourselves. That includes downloading government reports when they're still live, building shared data libraries, and training community organizations on how to collect and manage their own data ethically and securely. It also means pushing funders and institutions to recognize that community-based data is valid. It's not secondary to government stats. Because when the state stops counting us, we have to count ourselves and demand that others take that count seriously. If you're wondering how to help, fund the data work, share the data work, protect the data work, because data is not just a tool, it's a shield, it's a strategy, and it's a statement. We are here, we matter, and we have the numbers to prove it.
And generally, safe data, collected safely, kept safely, is safe when it's done kind of in that order. And so I know that there's Whitman Walker, Walt Whitman might also be doing it too, who knows? But is collecting a lot of the CDC websites that have gone down and stuff. And so I know GLAAD is also doing some of that work. So there are folks that you can turn to get some of that.
I think this is such an interesting question as someone who just finished my MPH, because throughout the semester I would be given assignments and I would go on the website and the website would be down.
404.
Particularly, there was a beautiful Friday in January that I saw on Reddit that the data set I was using for my thesis would be taken down, and then in an effort, I downloaded everything on that web page. I downloaded the data set, every page that was uploaded. I felt like a crazy conspiracy person. My partner woke up from a nap and I said, I have all the government files on my computer, let's go. I'm glad I did that though, because it was right and the data went down, and it came back I think a week later and it had all of the variables I needed gone, because I guess gay people and trans people don't exist in the eyes of the behavioral risk factor surveillance system. As a researcher, it's really, really difficult. These are simple questions. They don't take a lot of time to ask. They are not scary to ask, and most people, you can say no. A lot of people do. So it's the risk of asking it is so minimal, and the benefit of having it is so great because it gives you so much more information. Because I had the data that I did, I was able to find that LGBT people use cannabis at a higher prevalence than their heterosexual counterparts. I was also able to learn that they use more non-traditional methods like dabbing and vaping, which is becoming more traditional. So this is government data that we as taxpayers have paid for them to collect, for us to use, for researchers to use, and now they're taking away these parts. So as taxpayers, we should be concerned because we're shorting ourselves all of this information. And as researchers and grant writers and people who work in the community, it just takes some of our legs out from underneath us. I know LGBT Tech actually has a database of all of the websites. I'm working with them on adding data sets back in because I know a lot of public health researchers have done that. I'm actively talking to my lab about, hey, what data sets can we make public? How can we get data to the people? Because I think ultimately we need to shift to an area where people are knowledgeable about data and can kind of operate it to a certain extent on their own, so they can see it themselves, and truth can lie within them saying, hey, what are the numbers behind this? Oh, let me look at, TransPop is a survey that looks at transgender individuals. I'll look at TransPop, what's their quality of life in my zip code? Oh, there it is, there's the fact, and then go from there. I think ultimately that's the best way to go forward with it, and I'm so sorry. My nightmare. But ultimately that's where we need to get, and the removal of this data is just completely backwards and not what we need. So invest in community data collection. Yeah.
So the benefit of going last is that everybody said everything you were going to say.
All right, good. Next question.
I'll just say one thing though, because it's me. And you actually did a really great job of kind of pointing on this point is, like, it's so easy for us to work in silos, right? The benefit of this report, right, is that it's being shared and disseminated so that I can use it and Matt can use it, and everybody, Silk Lehigh Valley can use it, local government can, right? And we need to make sure that we're making these extra efforts to, in fact, share all these data points across, because we're going to have this problem for at least the next 4 years, right? And it's going to take us, after this administration, it's going to take us 8 years, 10 years to fix it. So we have to be collecting this data now and making sure that we're sharing it across for everybody's mutual benefit.
Yeah.
And then keeping the links active and making sure that everything's still updated. There are people who will use your data and you will have no idea. In 5 years, someone will contact you and say, hey, I use this. I used 2019 data from the New York Department of Health on out-of-home experiences, and that was presented to the Senate. And I don't think the people who worked on that have any idea that that happened. So just the availability of data online for people to look through and call through gets it out and is usable.
Absolutely. And you talked a little bit about, Corinne, like actually sharing it and using it in advocacy. So I'll ask you first, before you answer this question, sort of say, like, Christina and Krista were telling me before the stuff was out, they said they had people calling them, refreshing the Bradbury-Sullivan website, waiting for these numbers to drop. Who was like who were the first couple of people that you said, I need them to have this information? Or the third,
now you're
or the fifth, lie to me,
making my
whatever you got.
65-year-old brain work. So for this information here, I think that I used it this past year for us to go to the grantors that we know are on our side. I'll use the Gender Justice Fund, which is a Philly-based organization. And they've been very supportive of us over the last few years, but they were one of the first organizations I pushed this data out to, not only because I wanted them to give us more money, which, by the way, we got yesterday. But beyond that is I wanted them to make sure that they had that data because they support, a dozen other organizations, queer organizations, that work in areas where we don't work. And we want to make sure that those organizations are getting more money too. So I think that is really kind of like the first thing, is like making sure that the right brains got that information early and often. Yeah.
All right, so then, you do this a lot, you do a lot of advocacy, you train folks in how to advocate. What advice would you give to a noob who just wants to do something?
So I will say this with all respect for my wonderful friend Ashleigh Strange, is self-care is an important thing. Actually, a number of us were having this conversation earlier with Ashleigh about that, because Ashleigh is like freaking everywhere right now. And apparently has to have the hotline to the governor open on their phone 24/7. But we need to make sure that we are, if you're going to go into this work, it can feel like a lot. And you don't go into this work unless you have a degree of passion, and that will make you go 24/7. And so at some point you're going to hit a wall where you're going to collapse, right? Or where you're going to, like I threw my back out on Sunday, right? And like I staggered into my house after carrying tents from a pride, and my wife goes, "What are you, nuts?" And the answer is yes. Right? So I think that, if you really want to get into this, number one, start investigating, make sure you're connecting with people who really care so that you can feed off of their passion, but then be smarter than I am, or smarter than Ash is, smarter than Jason is, and just like periodically take that little bit of breath. It's okay to take a weekend off. It's okay to turn your phone off. Believe me, the world and the problems are still going to be here in 24 hours. That's my advice.
Oh, yeah. Meredith, who was the first person that you know, or the first entity that you remember sending the data to this year?
I definitely sent it to my partner, and they were like, why are you sending this to me? I'm in Boston, I'm getting my MPH, I don't need to think about Pennsylvania right now. And I said, no, this is so interesting, like we should look at this. And then probably all of our funders that we report to, I think it's really interesting to always include this as an attachment just so they can see the scope of everything and gives more background. Do I know if they look at it all the time? Maybe not, but it's good that they have it and it goes on our file.
It's just saved as the background on your laptop.
Yeah, I look at it, that would be actually so smart, because then I wouldn't have to have another tab on my laptop. But advice I need to take the advice of resting, and I hear that a lot, and it's hard to take. But I would say follow your passion, which everyone else says, but really follow like your inner gut feeling. I think that's kind of what's led me to everything I've gone into and everything I've looked at, is I see the world around me, and if I have a question about it, I kind of hyperfixate on it and really will try to piece it apart. I just did my thesis on cannabis, so that's always in my head. I knew communities around me use cannabis more, and I also know that overall sexual minority populations use substances at a higher rate. And I said I'm really interested about cannabis, and I followed that path down, and it's a very interesting stuff. And
we're all getting a copy of this.
Hopefully, I don't think it's that good, but I don't think anything is good. So, but very interesting data, hopefully to be published. But really, just following what you see around you and trying to spread that, and understanding like, hey, I see this, and it's really, I noticed it at Bradbury, I noticed it at another institution, I noticed it when I went to Pride, why is this happening, and kind of figuring that out in your head. And I know I've said it 4 times already, but mulling it in the back of your head and just being able to have those strings and keep pulling on them and working through it. And I think that's what gets me through when I hit the wall, because you will hit a wall and it will feel awful, and you'll want to cry, and it'll feel like the world is ending, but ultimately it's not. And I've had so many people pull me out of that. So follow your passions, be prepared for the wall, and have your passions get you through that wall.
Who's the first person you sent this to?
So not a person, but a group. I am very active in the Association of Fundraising Professionals. While I live in the San Francisco Bay Area, and I'm president-elect of the Golden Gate chapter, I still have...
It's a little closer to your mouth.
I have great ties to the Lehigh Valley AFB chapter. I just presented recently at their regional annual fundraising conference. And a lot of my presentations to other fundraisers is focused on how they can prioritize the LGBTQIA+ community in their work, even if they're not a specific queer serving organization or their mission isn't LGBTQIA+ specific. And when I'm educating them about how to include LGBT people in their work, I am always advocating that the LGBT community is so intersectional that we're everywhere. And so whether you're queer specific or not, you are, whether you know it or not, serving LGBT people. And data is at the core of being able to advocate for them. And as nonprofits, they often don't have the capacity to collect the data themselves. And so nonprofits in PA, guess what? There's already an LGBT health needs assessment ready for you to go. So as far as advice, I would first say that queer stories often are centered around and lead with queer trauma. And so my advice would be lead with queer joy. Spread queer joy. And start local, start relational, and start now. Advocacy doesn't have to mean lobbying in Harrisburg or speaking on a stage. It can mean showing up to city council, calling out anti-LGBTQ+ bias at work, or helping a queer teen access gender-affirming care. My advice is to ground your advocacy in community. Know who you're standing with, not just what you're standing for.
Also, learn how the money moves. I think we talked about that up here a few minutes ago. Whether you're organizing, policy making, or even just storytelling, understanding how the funding works and how to follow it is one of the most powerful ways to make systemic change. We need more queer people in philanthropy, in nonprofit leadership, and in spaces where decisions are made about our futures.
The first person that I sent this to was my legislator, because I am who I am all the time. Thankfully, my representative is Ismael Smith-Whitell. He is, in fact, also a member of the queer community, so it's a pretty easy conversation. That being said, I would say anyone, and this will actually tie into the next piece, anyone who makes a decision about what resources other people in Pennsylvania have should be looking at this data set. If you are a decision maker around laws, you should be looking at this data set. If you are a decision maker around health, you should be looking at this data set. If you are a campus administrator, well, I talk to on a pretty regular basis now, you should be looking at this data set because the human beings whom you serve are queer. And so, the advice that I would give to someone who wanted to be an advocate for the LGBTQ plus community, I would say start by looking for small opportunities where decisions could be made slightly differently to expand who is included. I work for an organization now that many of the humans in leadership are queer top to bottom. We love that. I have also worked for organizations in which most of the time, in most of the conversations, it was very clear that I was maybe the only queer person on staff, or maybe sometimes the only queer person the people I was working with might know in an interpersonal kind of way. And so there are little opportunities to hold up a mirror. I am known for telling folks what they care about, right? And so often I will say things like, as an organization that is committed to public health, I actually think what we should do is, and then, tell them the new change in pace. Maybe we don't need to have things that are unnecessarily gendered, because that will better serve people who are impacted, right? And so I just often hold that mirror up. As an elected official who is really committed to public housing, I think it is important that you look at, insert data stat here from the LGBT Complaints Assessment, because it will better equip you to meet people's needs who are unhoused, right? So the more opportunities you can invite people in gentle ways, remind them what their values actually are, and then show them how the thing they could be doing differently actually goes back to meeting that value, the better. Additionally and finally, I think that there are moments in time where there are going to be people who you simply cannot move on an issue, and there will be opportunities in which you could run up against that brick wall. Instead, I love to pull in the people who ostensibly care about me. Hello, lobbyists at the Heart Association. You're going to meet with Stephanie today, not me. And so, providing that opportunity to look and see who else is in the room, who could be a better messenger, if in fact it is going to be detrimental to my health or well-being, or the end goal that I want, if I'm in fact the human being delivering that message. And then finally, I like to remind folks to look and see in any decision-making space, what are the lived experiences of the folks making that decision? That will tell you exactly how much they know to look for as a white, queer, cis, chronically ill, autistic woman. I have a very specific way of looking at the world that I know what to look for. That is valuable to organizations who are particularly limited in the diversity of their decision makers, and there are outer limits of what I know to look for. So I have to see who is not in this room right now that we need to bring in, because I have a limited scope and the people next to me have a limited scope. So how do we broaden that tent? Yeah.
And also send not only this one, but make sure that they're getting the previous surveys. I sent it to my PCP, my top surgeon, my OBGYN, my therapist, everyone got a copy. And now you all will have physical copies to leave in the doctor's offices. So we have a couple of folks with microphones out here. Does anyone have any questions for our panelists? We've got one there. Do we have a second lined up? Okay.
Hello.
Howdy.
My question is in regards to the fundraising piece. I want to know, or I would like for anyone on the panel to speak to, if you have had, and if so, what has it been, experience with fundraising specifically around folks who are mobilizing wealth redistribution specifically? And if so, if you would like to speak to the audience about your experience around that.
Wealth redistribution. Little Peter Pan action. What could you say a little bit more?
All right. White people with stolen wealth, basically, like giving their wealth back, right? And so we use it as resource mobilizers. It's not just, it's like funding, but it's also land, it's also facilities, it's a whole wealth redistribution of resources. And specifically the question is for your organizations and your work and your research specifically.
Does that make more sense? Right.
So a lot of the work that we do is mutual aid based. And so, we ask funders to give us money so we can give it away. And I wouldn't say that we're involved in wealth redistribution. I would say that we are involved in crisis mitigation, right? So we don't want somebody to become homeless. So, we give people money for rent so that doesn't happen, as an example, right? So this weekend I paid rent for two people's electric bill. We got food for half a dozen people, right? A lot of funders are not into that. The idea of give us money so we can redistribute that money, right? And whether that's for kind of the mutual aid piece that we do, or for the broader piece that kind of you're talking about redistribution. And so really being able to tell the story that, over 40% of the people who are here in the Lehigh Valley who are queer struggle with housing access, as an example, right? We need to be able to tell those stories, back them up, with the quantitative data, right, to try to build that case. And then I forget who talked about, building the relationship with the funder is really important. A lot of times these grants start off really small, and then you can kind of build and grow. And then you might be able to get the funding to build the program that you're looking for. I don't know if that answers the question, but I'm hoping a bit.
Hey, hold on just a second.
I just want to clarify, because I wasn't speaking in terms of you as an organization redistributing. I was talking about you as an organization accessing, resource generation is probably the most well-known organization. So you as an organization, and fundraisers, grant writers, accessing that specifically. So not you taking care of it, but yeah.
Yeah, I spend a lot of time trying to convince people that they should do a thing they're disinclined to do. And so one of the ways that I do that is by, one, looking at what it is that this person cares about, whatever that funder happens to find valuable. Two, how do I connect that, the thing that they care about, to the world that I actually want? So we know with all people, power is a relationship. So if I can build power with other people to influence power over a human being who in this relationship has what I want, then that is meaningful. Similarly, if that person who has what I want is disinclined to give me what I need, then I can look at two different types of things. One is, again, what do they want? How does helping me move them closer to the world that they want? Or there is a world that they don't want to live in. How does their lack of interest in working with me, if they don't work with me, how can I move them closer to the world that they don't want to live in? That is the sort of continuum that we are regularly working through. So it is either, how do I make you interested in this? Often with particularly, just to be extremely transparent, with particularly like white foundations, white tech worlds, they're often motivated by what I call hypothesis testing, right? And so we'll say, let's just experiment. If we do the thing that I think we should do, let's see what we learn from it. Rather than convince them this in fact will work, you should do it, I open up the possibility that we're just gonna try it, we're gonna see what we learn. Many times I am right. But we started that relationship not from, you have to do this way because I am actually an expert, but okay, let's try it together and let's see where we get. That is motivating for white tech firms, white foundations. For folks where, again, we're gonna try to move you closer to the world you don't wanna live in, these are elected officials often. What they don't want is they don't want bad press. They don't want people bothering them all day long at their office. They don't want a bunch of like weird postcards or whatever random stunt you happen to send them. I once sent a bunch of umbrellas, don't worry about it. They don't want to be bothered. And similarly, they don't want to lose their jobs. So how do we either move them closer to the world they want? I want positive regard for my community. I want to be known for being the kind of person that does this. I want to be able to say like, oh, look at this great thing that I did. Or I really don't want to be bothered and annoyed and I don't want to lose my job. Those are really the two outcomes, and you just got to figure out where you can, again, use the resources you have to get what you need by building power with other people or exerting power over those who have power over you.
And I think that's the key, is working with other people. Like, we all had a chance to sit down with some nice turkey sandwiches this afternoon. Like, let's not let that be where it ends. We need to all stick together, work together. You know, there are a lot of times where it seems like we're conflicting or we're butting heads up against each other, competing for the money. But somebody at the Dyke March in Philly said this earlier. They said, we can, we shouldn't fight amongst each other now. We should work together to build the world we want. And once we get that, we can argue like family. But right now, we've got to stick together. So thank you so much to our panelists. I'm sure that Christina has something else going on. Big round of applause for the panelists.